Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, I'm Ryan Heffelfinger. I am a professor at Thomas Jefferson University Hospital and the director of the Division of Facial Plastic and Reconstructive Surgery.
Hi, my name is Neha Garg. I'm a current research fellow within the Division of Facial Plastic and Reconstructive Surgery. Dr. Heffelfinger, today I'll be asking you a couple of questions regarding a paper that we recently published within FPSAM. Our paper is titled Chatbots as Patient Education Resources for Aesthetic Facial Plastic Surgery, an evaluation of ChatGPT and Google Bard responses. So I was wondering if you could talk a little bit about why we decided to look into this topic.
Sure, I'd love to. So, the internet and social media, as we know, has become a go-to source of information for patient-seeking aesthetic interventions. With the recent growth of AI chatbots like ChatGPT and Google Bard and other more large language models, we noticed that patients have started to look to these resources as a source for medical information. We wanted to see if the information that they are accessing is high quality, accurate, and easily comprehensible. It's important to note that the NIH recommends that patient material should actually be written at an 8th grade level. For that reason, we wanted to generate and compare the accuracy and complexity of responses that ChatGPT and Google Bard provide to questions about aesthetic facial plastic procedures that were familiar to us, specifically rhinoplasty, blepharoplasty, facelifts, and brow lifts.
That's awesome. Can you discuss how we went about collecting the data?
Yeah, we asked ChatGPT 3.5 and Google Bard 28 questions related to rhinoplasty, facelift, blepharoplasty, and brow lifts with 4 different prompts. The first prompt was no prompting. The second was a patient-friendly prompt. The third was 8th grade prompting, and the fourth prompting for citations. Our surgeons, fellows, and residents then graded those responses for accuracy and quality. We wanted to see whether responses fell within the NIH recommendation, so we evaluated response readability and complexity for each response. We did this by calculating Flesch-Kincaid grade level and Gunning-Fogg index scores for each response. We also evaluated the veracity of the citations provided by each chatbot.
Can you discuss some of the interesting findings that we noted?
Sure. Well, overall, 98% of ChatGPT responses and 70% of Google Bard responses to no prompting or patient-friendly prompting were accurate according to our reviewers. ChatGPT generated more clinically accurate responses compared to Google Bard, regardless of the prompt. While prompting did not impact accuracy across chatbot-generated responses, it significantly altered readability. When prompted at an 8th grade level, both chatbots produced responses above the NIH recommendation for patient material. Following 8th grade prompting, ChatGPT responses fell between a 10th to 12th grade level, while Google Bard responses fell between a 9th to early collegiate level. However, with 8th grade prompting, only ChatGPT yielded significantly lower grade level responses compared to the other prompts. And finally, 45% of ChatGPT responses and 72% of Google Bard responses were illegitimate with no referenceable DOI. Of the 41 legitimate and correct citations across both chatbots, only 49% provided the information and findings as stated by the chatbot.
Great. So what are some of the future directions for this topic going forward?
Well, I think future investigations assessing the degree of patient satisfaction with chatbot responses would be extremely valuable. And then continued studies can verify accuracy and utility of paid versus free chatbots. For example, the ChatGPT 3.5 that we used was a free version. There is a paid version. It's currently called ChatGPT 4. So we can look at those and see how they might be more helpful in patient education.
In conclusion, we appreciate the opportunity to present our work and our data to FPSAM.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.